Hello, hello, hello. Happy Tuesday. Happy second day of fall. Summer is officially over, I guess, but we are having some beautiful weather here in Chicago. Good evening to all of my viewers. Thank you so much for tuning in once again to the Doty Report on Comprehensive Health. My name is Yolanda Givens, and I am the host. And please like and share. Tell somebody about the show. We are bringing you health, education, information. We are just really trying to share information and resources and make connection for people to have access to anything related to creating healthier homes, healthier families, and overall healthier communities. I am excited to be a part of this show and to be able to come to you and bring to you information. I mean, we're talking about health physically, mentally, financially, and spiritually. We're trying to bring it all to you. We hope that you have found these shows to be very informative. So do tell somebody, like and share right now. We're trying to get this viewership up and we're trying to get as much information to as many people as possible. Once again, thank you so much for tuning in to the Doty Report on Comprehensive Health. My name is Yolanda Givens and I am the host. I'm excited tonight because we have the Georgia Doty team, and they are going to be talking about the history of the organization, what the organization has been doing, and this organization has declared war against COVID-19, and they have been active in the community doing their part to help fight COVID-19 to help us all stay safe. So we're going to learn about the organization tonight, hear from them, hear why we even do the show. It's because of them. So I want to get right down to it, introduce and bring the guests on and really begin this chat and let them share with all of you what's going on with the organization. This organization has been around for 20 plus years. There is a rich history and legacy behind the organization. And I just commend them. Kudos to them for being in this journey, on this path for so long, and really having a passion for the community and bringing opportunities and awareness. So let me bring to you our guest for tonight, the Georgia Doty team. I'm so excited. We have the founder and CEO himself. I usually give a shout out to him, but he is here with me tonight, Mr. Don Doty. Again, he is the founder and the CEO of the Georgia Doty Comprehensive Health Organization. He has been doing this in Chicago for a very, very long time. So we commend him for his passion and for his work and for his drive to continue to be an advocate for building healthier communities. Also, we have Jack Orlov, who is the chairman of the organization. How you doing, Jack? We are excited to have him. He has been a part of and on the board of the organization for a number of years now. He has contributed to the organization in many, many ways, and he has a lot of information to share with us this evening as well. And last but not least, we have Cheryl Garrett, who is the corporate liaison for the organization. She is Mr. Doty's right and left hand. She, in her own right, is a woman of inspiration, and two, does her own thing, trying to bring awareness and really help the community live healthier lifestyle. So hello, 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 hello. I'm so excited. Everyone gets to see the Georgia Doty team. They get to see why we're even doing this show. And we get to hear from you about what the organization has been doing as it relates to COVID-19. Everybody have a role, and I know that it has been a challenge for community organizations with the whole shutdown, social distancing, because that's what community organizations do. We get out, we reach the people, and to not be able to do that has been a task. It's been very hard. But this organization, I know, have begun to be creative and come up with ways to still reach out, still get the information out there, still make sure that they're doing their part to create safe and healthier communities. So I definitely commend them for the hard work that they've been doing. So we are going to start with Mr. Doty, who is, again, the founder. He's the CEO. He's the man behind the whole vision, and he is very passionate about the work that we do. And so we want you, Mr. Doty, to share with the viewers some brief history of the organization.
Well, the Georgia Doty program was set up some years ago. When my mother died, Harold Washington invited me to duplicate a school that she co-founded. She set up the first minority allied health trade school in the United States, and we were very successful in breaking the welfare cycle and providing opportunities for a lot of minority, mostly women, to not just be a CNA or a healthcare worker, but actually get into the allied health trades. And so I came to Chicago. I set up a school called Center for Employment Training, located on Holman and Arthington on the west side for 25 years. And we trained over 2,000, 2,500 individuals that broke the welfare cycle and provided jobs, which they need jobs now. And we had about 1,000 individual inmates that came out of prison that had
Mm,
records and couldn't get jobs. And we provided them jobs in the building maintenance trade and got them into various union trades here in Chicago. So we
mhm,
were very successful in that. The next vision I had was to set up a nonprofit program foundation that we would reach out, provide not only scholarships and financial assistance for those that are in going to school at Malcolm X and various city colleges, but we also provided health education. And so for the last 15 years now, it's been dealing with HIV, hepatitis, respiratory diseases, and illnesses that basically weaken the immune system of a lot of seniors, a lot of veterans who have immune systems against the virus. And I was very blessed to have a team of volunteers to support the vision. And now we're looking at establishing our program in Atlanta, LA, and Vegas. We received a proclamation from the state of Minnesota and also for Los Angeles for our success there also. So we're in the last leg of another legacy that we're trying to build. And with the team of people that we have that believe in trying to make a difference in the world and reaching the underserved population, I'm very blessed.
you are, and the city of Chicago is very blessed to have someone like yourself that has a genuine and true passion. But I guess it's in your blood.
It's in the
From
blood.
you get it from your mama, right? That's what I hear. You get it from your mama, as they say. Um, but it is amazing. You are definitely leaving a legacy, and I think it's important for viewers to just see someone like yourself that's been doing it for a long time and being able to show the sustainability of a nonprofit organization and be able to see the role that community-based organizations have in just the betterment of our community.
Yes.
Community-based organizations are very important. Funding for them are very it's very important. So yes, if you definitely want to donate to this organization, you can paypal.me/Georgia Doty. Go to their website, georgiadotyhealth.org. So I understand that you have declared war against COVID-19.
Yes.
So what does that mean for your organization?
Well, we have dealt with health education for some years. And now, because of the virus, we've been able to research and study to find that the most people at risk are the senior population, minority population that don't have insurance and health services to provide them the kind of treatments that they need necessary to strengthen their immune systems. So basically, we just took all the various health issues that we've been dealing with and signed a declaration of petition last week at the yacht club to
Mhm.
dare or declare officially our war against the virus. And as hospital nurses are first responders, we are ground responders. We deal with the homeless. We deal with
Right,
the underserved. We deal with the
right,
folks under the bridges
right,
and the tents, folks
right.
that are basically at risk. And I
Right.
think that we've been very fortunate to work with various Commissioner Dennis Deere.
Mm-hmm.
We've worked with Alderman Sophia Stephanie Coleman in various districts and in the Inglewood area. So I think that by the virus being as it is, we have to deal with Zoom and other areas of reaching the public. And we've been very successful at doing that. And I believe that it's part of a vision. You know, sometimes you get into the money part, and the money part is important to achieve your goals, but it's the vision and wanting to really make a difference. People get hung up in their titles, in their financial wealth, in their status in society. But sometimes you got to put it to the side and think of how to bring another brother up, another sister up, to provide opportunities and just expose the resources that are out here. But a lot of folks don't have access to those resources. And I
Mm.
think that the Georgia Doty team of volunteers and the board of directors have guided me and guided our staff in directions that we want to go in trying to make a difference.
Ah, I knew there was a reason I like you. I love what you just said. It is so important that we reach back, that we share resources and information and try to make that connection for people who just may not be able or just may not know or just may not know how to access those resources. So, organizations such as yourself, especially one that it connects with the health part because our health in our community is important. Without that, I mean, we ain't got nothing else.
Right.
So yes, I love your passion and I love your commitment to not just serving the community, but to reaching out to those that we know definitely need someone to look out for them, the homeless.
Yes.
Um, Veterans, the
Yes.
seniors, people, yeah, people that sometimes get forgotten about.
Yeah.
Your organization is making sure that, particularly now and across the board with this COVID-19, to making sure, my understanding is you guys have been making sure that they have masks and glove and hand sanitizer. And we're going to talk a little bit about some of the community the outreach efforts that's been going on. And I want to ask your chairman, Jack, to come and share some of that what's been going on as it relates to the outreach of the organization.
Okay.
Thank you, Yolanda, and hello, Dan. So I've been in the healthcare world all my career right out of college, and it's very important to be seeing what's going on today and how it's pointing out some very, very bad things that were happening for many, many years
Mm-hmm.
in the underserved communities with the veterans, the homeless veterans, and how to put together a program moving forward to, number one, get education into the hands of the people that don't know what's going on, that don't know what to do about it, that don't know who to reach out to.
Mm-hmm.
And bottom line is the only avenue that they had in the past was go to the emergency room. Not the right place for them for the certain things they're dealing with, and certainly
Right.
not the right way to block up the hospitals. And it's the most expensive place to go to in a hospital when there's so many great providers out in the communities ready and willing to be at their side, whether it be at home, whether it be in a nursing facility, whether it be an assisted living building, everywhere that they can be, we can be. And our main mission today is to bring the education into the underserved communities, into the
Mm-hmm.
veteran communities that are still out there looking for help. We had an event before this whole pandemic hit us down in the south suburbs where we had over 100, 150 veterans. And the
Mm-hmm.
greatest thing that I took out of that one was there was an 800 number for any of them to call and reach out for any help they needed. I'm not sure a lot of them knew about that.
Right.
Just like with our program, there's a lot of people, the Affordable Care Act, which we don't want to get political, it's a wonderful program. Is it perfect? Nothing in our healthcare system can be perfect.
Right.
It offers many, many programs, many, many procedures. And the biggest thing is all the preventative services. And most people I talk to don't even know the whole list of 30 some preventive services that the people get with no copay, no deductible, and as I say, no excuses. So you make it available. And what's the number one way? Because we're always talking about finances and economics to save money in our healthcare system.
Mm-hmm.
Don't use it. If
Mm-hmm.
you prevent the disease, you're not spending the crazy amounts. I just saw stats on diabetes. We spend $326 billion on diabetes.
Mm-hmm.
So let's say Georgia Doty is not going to be out there. We're not going to cure it. But if we can have an impact and stop 10% of the people because of bad nutrition, obesity, other issues, not to have diabetes and all those medications and all those procedures, that's $32 billion back in the system and a lot of people healthier and happier, not dealing with that disease.
Right.
So when you look in the underserved communities, the statistics, and that's the only, and I don't want to say this the wrong way, the only good thing that came from COVID is the focus on the underserved communities of 3 times the people in those communities, the Blacks, the Latinos, Asians, are dying versus the Caucasians, the other areas. When you look at diabetes, 3 times the incidence in the underserved communities versus outside. And you can go on and on with the obesity, with the nutrition problems. It's just a massive, massive problem that we want to step into to help get rid of it.
Right. Right. Absolutely. Sharing of information is so key. Just getting it out there. And you're right. Preventive. We could prevent some of these diseases or at least kind of curb the stats on how many people are being affected by it. That will make a huge difference in the community over across the board, and not waiting. That's why your organization is so important. Organizations such as yourself that is really doing some groundwork, some kind of grassroots type of work, and really reaching out to the community. So I want to hear a little bit about. We're going to bring Cheryl, your corporate liaison, and again, Don's right and left hand, and
Thank goodness.
a true asset to the organization to talk about some of the programming, some of the platforms within the organization outside of the Doty report, because everybody knows the Doty report is one of your initiatives. I think this is the 6th season, and it has become a vital source of information and a resource to the community, especially now. But even prior to COVID-19 was providing great information. So Cheryl, talk about some of the platforms and resources within the organization.
Definitely, Yolanda. Hi, everyone. I am very grateful, even proud of the tenacity of the Georgia Doty
Mhm.
Comprehensive Health Organization because of the way we've been able to respond as the things Jack was laying out, and we wanted to carry out the vision of Don, and we've been able to execute that in the midst of a pandemic. We're continuing on. We never stopped. We continued on. And so it's a great thing in that we were able to um, get these platforms in force and still help the underserved community, still get out there health information that is viable for preventive care, that helps in the care of making sure information is out there, that people know how to keep up their immune systems. Now, Yolanda, you just mentioned about the Doty report, which has been around several seasons, and we're very proud of that. You have brought on many guests, Yolanda, and I know Rochester's been working diligently with this effort where we're keeping people informed. One of the great things about Georgia Doty is that we stay on top of things. Now, we have been, as Don mentioned earlier, very grassroots. We're out there with the community. We're hosting events. We're partnering with community organizations at their events. But during the pandemic, we had to find ways where we could still reach out to people, still help them with disease prevention, still
Mhm.
help get
Right.
the information out to them. And we were able to do so by getting on with the trend of, going online, getting our information out there and resurfacing. So along with the Doty report, which provides great information, great guests of things of concern, issues of concern, we also have a brand new program, the Chef Drake Cooking Show, which is fabulous because it's helping people while we're home. How do we eat? And it's called Soulfully Plated with Chef Drake.
Right.
how do we eat healthy? How do we keep our families from spending a whole lot of money right now to eat healthy? How where are the quick meals that can be prepared? And that you can find on that show. There's a lot of information about what items go together, how many calories, what the content is, something the kids would love to eat too. It's very tasty. We just experienced that at an event we had. It was very tasty and healthy combined. And so that's one of the ways that we're able to boost our immune systems, keep our immune systems up, make sure we're doing the right things there. And then the Georgia Doty publication goes out quarterly, and it provides great information. It has wonderful writers that contribute to it. There are many advertisements within that newsletter that give different sources to different companies and organizations where help can be found for different things. I am so excited. We have upcoming the 24-hour suicide prevention hotline. So we do have someone who is going to support that, who has a medical background. She's a nurse, and people can call this line because we know during this pandemic, even more so, people have become depressed, they're
Right.
confused, they don't know what to do. So that is being established, along with we have referral sources of where people can go, where you can get help, where you can get food, where you can get different medical help or advice or information, housing, for jobs, especially for the homelessness, those who are unemployed or underemployed. So there's so much out there that we have been able to pull together a lot of resources from our community partners, as Jack was talking about, and just collaborating with others in the community to get information out there and make sure that the underserved community doesn't go unnoticed.
Right, absolutely. We definitely want the underserved community to not go unnoticed, to not be forgotten about. It's so important across the board and everything. And so let me just let's connect right now to the community and the viewers that are watching. And for you guys that are in the nonprofit arena, in the healthcare field, when the pandemic hit, when they shut it down, when we got the executive order to stay at home, what were you thinking? What was going on in your mind, Mr. Doty? We're gonna start with you.
Well, I feel that a lot of the veterans that suffer from PTSD and mental health issues, I think that domestic violence, I think that I saw violence in the community. Uh,
Mm,
those issues are rising due to
mm,
lack of employment, lack of health services, lack of
mm,
training. They need to get
mhm.
into school. I wish I had the school back up again because
Right.
they need trades. See, there's only so many types of jobs you can get right now during the pandemic.
Mhm.
Construction is a good area. There's various areas that are open, but it's just a matter of trying to share that information to the public. And
Mm,
sitting at home and being confined, you eat and you gain weight, and drug use has increased greatly
mm,
with a lot of drug addiction. And so hepatitis C, which is our branding, has been a focal point because of the guys coming out of prison and those that are on drugs and sharing needles. It has risen. So those are all issues that have just come about that I feel that even though I retired some time ago, I just
mhm.
can't stop until I know that there's a problem and there's something that I can do and
Right.
share that vision with others as I've shared with you and have young folks to be able to take over that vision and to carry it on as I carried on my mother's vision. I hope that I can carry on, you guys can carry on my vision, and that is to really reach out and make our program a national duplicated program and initiative.
Right, 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 right. So you immediately begin to think about those. I don't know if we've even talked about that as much. We're talking about, the numbers in terms of who is exposed and who's actually haven't, had COVID-19. But I don't know if we talked about things like domestic violence and that the suicide rates have they went up and the use of the drug, substance abuse. What's going on and how has this pandemic played a role in maybe even the rise in those incidents and those things that happen within the underserved communities in all communities, that's a good point. We're gonna come back to that. So Cheryl, what about you? Just you, um, as a person when the you were told to, like, this executive order, stay at home, can't go to work, can't go outside. What
Mhm.
was going on in your mind?
Well, the first thing I thought about, because I have a mother who is a senior
Mhm.
citizen, my first thought was about the elderly because I work with a lot of elderly people, and I thought about them being isolated. You know, if some of their underlying conditions would go unnoticed because at the forefront of everything is the pandemic.
Mhm.
But there are still those who have diabetes, still
Right.
have to get their medications.
Right.
They still need someone to go to the store for them. They
Yeah.
still, sometimes their kids were getting sick and couldn't come see them. So they were having to do drive-bys just to wave at them through the window. What about those in the nursing homes or assisted living? So that's really where my mind traveled to. What are we going to do in light of, yeah, the pandemic is in the forefront, but what about all those other underlying things? And so that's where my thoughts and prayers were geared towards.
Right. We got to make sure that we don't forget those
Mhm.
things. That those things have not been forgotten about. I know for me, I thought, like, when we first happened, like, okay, this is different.
Yeah,
This is different.
very different.
After week 1, 2, 3, 4, 5, I'm like, this is becoming our norm. So we're all having to deal with that. And yes, the senior population, and I know we've talked about that before on the show, and the people that just weren't able to access and get to. I've heard people say that they haven't seen their mom in months,
Mhm.
because of this situation. And the mom is 80 years old, and there's no one else around. So yeah, we definitely have to. There has definitely been a concern and an issue in the community throughout this time. And so, Jack, what about you? Um, you've been in the healthcare profession for a while. What were you thinking and your thoughts when we got the stay at home order?
Well, those that know me know that I'm a very social person, and we're out all the time at meetings, at events, at seminars, at healthcare groups that we're a part of, and everything else. So immediately when that got cut off, and you're sitting at home, it's like, okay, now what? And you find ways. I mean, obviously, everybody today knows what Zoom is. Never
Right,
heard of it before.
right.
What we're doing today, we usually would be at Can TV station and being on air with the cameras and the whole routine. So,
Hmm.
what is it that we can do versus what's shut down and what can't we do?
Right.
That's probably one of the biggest issues today, especially with our desire to be out there in the communities educating people and
Hmm.
working with groups on different programs, is that a lot of them we can't get to.
Hmm.
And how and when is it going to change
Right.
is the big question.
Right.
We still have a long way to go. And it's funny when you're mentioning the one thing there about the underserved communities, it jumped into my head that what we don't want to see is the underserved communities becoming unserved.
Right.
So
Right.
we really need to be able to step out. And it's getting better that we can actually, some people still stay away from the grocery stores.
Hmm.
Some won't go to restaurants that have the outdoor seating. We've started to do a little bit more of that just to get out there and help the business world,
Hmm.
because as we all see, that's crashing and taking a huge toll. But we also have to be very, very careful.
Right, right. So as an organization, and to all three of you, what do you see future wise as it relates to a community based organization in the community that is an advocate for quality health care and access to quality health care and just the promotion of healthier communities. What do you see, if any? And you may not know yet because a lot of things are very uncertain for a lot of people. But what do you see, if anything, future wise for the organization or for the community based organization and their role across the board?
Well, I'd like to just say one thing. I think that I see Georgia Doty adjusting to whatever our new normal is and
Hmm.
carrying that out into the communities. I think that is going to be really necessary as Jack just mentioned, things are not going to be normal for a very long time. And they
Mhm.
definitely aren't going to go back to how it was. So I think we have to be in the forefront continually carrying whatever the new normal is and helping people to adjust to that.
Right. I like that. That we have to adjust as leaders of the community, as a very important part of the community. We have to adjust and we have to make sure that we are still able to reach the people who need to be reached. Like Jack mentioned, we definitely don't want the underserved to be not served at all. What about you, Mr. Doty? What do you in your head or vision or future you see with the organization now, being that we've been going through this for months?
Well, I see now that we have a team and we have the capacity to carry out some of the things that we need to do. Funding is very important. Lack of funding. I think so many agencies are hurting funding that the funders are backing up and being restricted on who they're going to supply funds to or support. So it's very important to network. So agencies not to just go by themselves, but to join forces and network to be able to combine and strengthen the resources that are out there and to come
Mm,
together as a
I
team.
like that.
I think that's a very important thing in terms of collaboration. And that's the
Mhm.
big word now is collaboration and partnership.
Right. I love that you just said that because so often organizations get on an island by themselves, but really we need to definitely be collaborating and build some sort of agreement and camaraderie so that we're able to reach as many people as possible. Limited resources, limited funding opportunities. So coming together to make sure that get on the same page, and I think everybody have their niche or their role, and if you put it all together, it works for the betterment of the community overall. So that's important. So anyone out there listening, that is anyone out there viewing that's a part of another community-based nonprofit organization that's looking for an opportunity to volunteer, would like to learn more about the Georgia Doty Comprehensive Health Organization, please go to the website georgiadotyhealth.org. This is an organization that is out in the community, themselves, doing the footwork themselves. Even Mr. Doty's been around a long time, but he's still out there footworking, as they say, and really going out and reaching the community. The organization is always looking for volunteers and always looking for other organizations to partner with, looking for sponsorship, looking for businesses to partner with. So go to the website georgiadotyhealth.org to learn more about this amazing organization and how you can be a part, can volunteer, can help make a difference. I want to ask Jack. I didn't give him the opportunity as the chairman of the organization. What do you foresee the future of the organization, if anything, at this point?
Well, actually, there's a lot of stuff that's going on because there's such a need out there.
Mm-hmm.
The biggest groups that we're looking for are partners for us in these different areas of health need. So we mentioned nutrition before, which is probably one of the biggest contributors to all the issues that people in the underserved communities have. So the cooking show with Chef Dre is awesome because how do we teach people? Here's vegetables, here's fruits, those are good for you. And then people go, what do I do with them? So we have to teach them not just what's good for you, but then how to do it, what to do with it, and
Mm-hmm.
how to change the life totally. Secondarily, is trying to connect and put together a whole team of providers within the system. I'm working now with a group that is actually a behavioral health organization.
Mm-hmm.
It has doctors and nurse practitioners and those people that can work, whether it be telehealth, whether they can visit them, but to be able to help with those issues because that's become a huge monster problem with people stuck at home with nobody to see, nobody to talk to, nothing to do. Another part of it is a group that I'm working with for pain management. We hear a ton of stuff about the opioid addiction problem.
Mm-hmm.
People, if they are in pain, they get hooked on it. What do they do? Who do they go to? How do they get off of it? How do we help them straighten that out? So we've got the nutrition part, we've got this part, we've got groups with clinics so that we can stop people from having to go to the emergency rooms, or if they can't get anywhere, don't have a doctor, to try to connect them with the appropriate caregivers to be able to help them. The other big thing in the healthcare side is hospitals are now sending people, usually just trying to send them home for whatever reason. A lot of them should be in a nursing home, skilled facility to get the care they need to be safe at home, but they're sort of bypassing that because people are scared of them. We have to, one, try to change that myth. But people in the home health sector, they're hurting for employees.
Mm-hmm.
And that training program going, they need a lot of help. The home health, skilled care areas, as well as the home care, just being there to be helping the person with shopping, with bathing, with simple types of everyday activities. And that's a very, very tough thing to find out there. But we've got organizations being in this for a long time, lots of groups that are very, very good and very, very qualified, that we want to try to put that whole team together to be able to service and meet all the different needs that we see throughout the community.
I'd like to say something. I think one of the supportive groups that I'm really proud of is a pharmaceutical company called AbbVie Pharmaceutical. They're supporting our program now and trying to educate the public on the hepatitis B and hepatitis C. And that's still an issue, even though you look at the virus, there's other health issues that are also prevalent that's increasing. But I think that the virus has gotten the full attention at the moment because of the pandemic. I want to say thank you to a lady who has a lot of ground resources that bringing to the table. And that when I went into the prisons, into all what do you call it, detention facilities, Beverly Walker, she's not here today. She's my COO. When we went into prison, everybody thought she was Georgia Doty. And she really made a difference because she had that maternal nature about herself that really cared. I mean, she has been a community social worker for many, many years. And I want to give credit to some of the team that aren't here that have really contributed a lot to the organization. Oh, and also I want to mention the fact that I'd like Yolanda to bring up, we're looking for telemarketers. Anybody that has good verbal, social, corporate background skills. We're looking for telemarketers. We have an office downtown at 33 South Dearborn, and we also have an office on the south side on 79th off of Stony. And I think we're trying to really find and hit the community in certain areas. And having volunteers and having some telemarketers right now is a very vital part of us being able to draw and create funding for the program to continue our vision.
Absolutely, and that's an opportunity for someone to possibly earn some money, right?
At the same time.
At the same time, possibly earn some money. So what have you? And I had some technical difficulties, but I am back. So I know you guys have been out in the community. What feedback have you gotten from the community now? Like, how would you say they're feeling? Do you think the community think things are getting better? What's been your interaction? I'm gonna start with you, Mr. Doty, because I know you've really been out there giving out masks, giving out hand sanitizer, and really communicating. I know you even gave out food a week or so ago. What's been the response from the community?
It's been very positive. I think we've had several hospitals. I want to mention Loretto Hospital.
Absolutely.
Has come to our support in that we have to provide resources for them to get the treatment and to get the services that's out there. And they're very important in the Lawndale West Side community into the residents. A lot of hospitals are having problems with people coming in with aches and pains that could have been taken care of if they were educated or if they knew better. The emergency rooms are already full with people that have very deadly illnesses, and those aches and pains that could have been rectified has been reduced. So we're getting a lot of hospital support. we're getting a lot of political support. And I want to give a lot of credit to Congressman Danny Davis, because when I came to Chicago, I didn't know anyone. He and Congressman Bobby Rush are the ones that helped the initial funding that we did to set up our program on the West Side, and they believed in the vision. You know, I'm a LA guy. I don't know nothing about Chicago. I wasn't that tough. I'm from Hollywood. You know what I mean? So I, I learned a lot on the grassroots. I also mentioned to the organization over at TWO, and that's the first job they assigned me to work in the South Side. And I'm very sorry that the Reverend who's in charge of that, I think of his name a moment, died and passed away. But those are things that have to be continued. I think that families got to continue family background history. I think a lot of young folks know nothing about Black history or where they came from or their history and background at all. I think that right now we need to educate our youth. I think right now the focus is on the youth because they're going to carry it on, and they're the most at risk. They don't think that they are vulnerable to these illnesses and wearing masks. I see it every day. And it's the parents that got to be strong enough to educate them that even though they are not sick at the moment, it doesn't hit them until somebody in their family gets hit or gets sick, where they really wake up to realize that they're at risk. And I think by being out here and trying to educate and work with the gangs, work with the different other organizations that are in the community and the underground world that people don't know about, we need to reach them also. And I think that we made a difference, and I think we can continue making a difference if we can get more support, build our board of directors, build our advisory committee. I think we need volunteers to come in and help us and guide us to the various areas that need our support. It's very important.
Right. I completely agree. So I think we have a video. I don't know if we're able to show the video that gives some history of the organization. If so, it'd be great to show the video, because you are correct in that I love that this organization does have a very rich history, and all of us need to hear all of the various stories and the back end of how a person or someone, how we became to be. So let's look at the video. Let's get a little bit of the video. Let's get some history.
We have two big needs. First of all, of course, is physical health, but also spiritual health. And that's exactly what this organization is doing. It has been doing for so many years, and Georgia herself is the saint for this organization. We're so proud of her for having started this. It's wonderful for what she has accomplished for senior citizens as well as for youth. And I'm happy to be a part of it, and I hope to remain a part of it. And I'm very proud of Don for having stuck with it, because he's had a lot of challenges, but he's managed to keep himself together.
There's no greater work one can do than to promote good health and health care. I don't care how wealthy you are. I don't care how accomplished you are. I don't care how much money you got. If you are sick, you're not in good shape. So this is outstanding work. I commend Don Doty for doing it. And Don has been the main educator in the state of Illinois, pushing the issue of hepatitis and the issue of HIV and AIDS, and has helped to educate thousands and thousands and thousands of people so that they know how to better protect themselves.
Don is a pillar of the community as founding president and CEO of the Georgia Doty HIV and Hepatitis Community Outreach. I especially appreciate all of your good work to raise awareness about hepatitis and HIV within communities of color. I have worked in Congress to support your efforts. I have spent my career in Congress working to serve the communities I represent and to protect the least among us. As long as God continues to give me good health and the people continue to give me their support, I look forward to continuing that work.
Amazing. You're the man, Don. You're the man. You are the man. I love it. I love it. I love it. I commend your passion, your effort. You just turned 73. Was it 73?
74 now.
74. And
74 young.
70, just turned 74 this month. And
Yes.
you are still on this journey, still working to make a difference and bring resources and information to your community. And you are commended. And I understand that you recently received an award. Can you tell us about the award you recently received?
Oh, it was from the National Lifetime Achievement Award, the National Civil Rights Library, Mr. William Thurman. Uh, he he was very impressed with some of the things we do, but that award is nice to put on a wall, but it's the thought that people are appreciating what we're trying to do.
Mm-hmm.
Hold on.
Absolutely. Absolutely. But it seems that you are very deserving of the award. It's not many that we hear about that's really been doing the work, continues to do the work, and have a true, sincere passion for the work. So I definitely commend you for all of your hard work and effort and commitment to continuously. I be trying to tell you to go sit down somewhere, and you just will not do it. So you are definitely.
But I have to say that all the achievement, all the awards, all the plaque, that's nice. You know what I mean? But it's the volunteers and the people that I have that encourage me, that motivate me, that keep me focused, that I have to give credit to the team. It belongs to the team, that board of directors and advisory group. A lot of the folks that people are not aware of that's made a difference, that's given me direction, being that I'm not from Chicago. I had to learn the hard way. I think that was very important that I have to give credit to my team.
Mm-hmm. Absolutely. 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 This show was so important. We're going to bring Jack and Cheryl back. This was an important show because we so often do not hear about the great people and the great work of organizations such as yourself, about the community efforts. The little people, so to speak. We just don't hear enough about the little people that's making a big difference. And you're not little people. I say that just to kind of be sarcastic, but a small organization that's having a big impact so often also go unseen, unheard about, unrecognized, unfunded. So it is just great to bring you guys here. So the folks out there that are viewing the Doty Report and really enjoying and feel like the Doty Report has been informative, can see the team of the organization and can hear and learn about the organization and why they should even get involved or even make a contribution. Every contribution helps make a difference. Please go to the website, georgiadotyhealth.org. You can send a donation via PayPal. It's a great organization. You got to see them up close and personal for yourself. And I commend all of you for the wonderful job and continuing the work, even through this pandemic, for declaring a war against this pandemic and doing your part and what you can as an organization, as individuals, to try to help make a difference and have an impact and stop the spread of the virus, which we know is so important. So I always like, we're getting close to the end of the show, I like to have the guests to give final words. We're going to go let ladies first. And Cheryl, what are your final words to the folks that are viewing tonight?
Well, I'd just like to say to everyone that in whatever capacity you can contribute to Georgia Doty, please do so. Whether it's volunteering, whether it's donating a few dollars or a lot of dollars, or if you have an idea or you have an organization that you think we should partner with, please get in touch with us.
Love it. Absolutely. Get in touch with the organization. Our chairman, Jack, what are your final words to the viewers?
Well, and I think Cheryl's right on it. And the ways that we are funded is we are looking for and applying for grants. There's a lot of companies out there with similar desires. We're there to help take it to the field and make it happen in the communities, as well as providers that would be partners and sponsors for us to work together to be able to provide these services to the community. However, we have to get to them, we'll figure it out and we will get to them.
Great. Amazing. Absolutely. So this is an organization that's looking to partner with any entity within in the community. And last but not least, Mr. Don Doty himself, what are your final words to the viewers?
Well, I look forward to working with the faith-based community. I think that spirituality and working with the churches within the community would make a great impact. So if anybody's related to a church or associated with a minstrel association, we want to network with the church. I think that we can get a greater reach out into the community, in the at-risk communities, if we can get more of the ministers and the pastors to come together and join forces with us. And I want to say thank again everybody who's watched the show. Anybody that has any questions, they know how to contact us. If anybody wants to join the organization, we look forward to it. We're trying to expand. Again, we're going to go national to Atlanta, LA, and Vegas. They've asked us to come there. They asked us to bring our programs and ideas there to their cities. And even though this is a risk factor at this time, it's part of our legacy. It's part of a dream. It's part of something that I promise to continue. And I think that God has given me the strength with the 100% disability that I have as a veteran. I look beyond that. I think that God's given me the inspiration, the guidance to draw together the people that believe in the dream and to continue the dream. I want to say thank you to everybody. And I thank you for everybody.
A man with a vision, a man with passion. Georgia Doty named after his mom. And you are definitely leaving a legacy, living a legacy, creating a legacy for her to be proud of. And I thank you for your vision. I thank you for your hard work. Definitely commend you. Again, those of you that are viewing, this is an organization that is doing great work, that is doing outreach in the community, that is having an impact, making a difference, doing everything that they could possibly do to help all of us live healthier lives and create healthier communities. I just want to thank you for once again tuning in to the Doty Report on comprehensive health. Thank you for listening. I hope this has been insightful. I hope it has been inspirational Some of you out there that want to get involved, make a difference, even start your own nonprofit. I want to encourage you to do it. Go for it. Live your dreams. Bring that vision into reality and live healthy. Congressman Davis said, and these are my final words. He said in that video, I don't know if you caught it, but in my own words, he said, it doesn't matter who you are, it doesn't matter how much money you have. If you are sick, none of that really matters. So our health, physical, mental, financial, and spiritually, our health is so important. And my final words is to you guys that you remember that and do all that you can to keep yourself healthy and check on your people, check on your seniors, check on your children, check on your neighbors. We are all in this together and we'll get through it. We will. Um, Thank you again. See you next time. Peace. I'm out of here. This Saturday, Soulfully Plated show with the chef. This Saturday, stay tuned. I'll make sure I post the information on my site.